And finally tonight, another story of technology helping out. This time, big data could reap big benefits. A recent study says the use of real-time analytics could cut healthcare costs up to 15% annually. That works out as much as $500 billion a year. And now there's a push by private businesses to help medical researchers collect data and treat patients. So we kick off a new series on the future of healthcare tonight with how IBM's Watson computer is helping doctors at the forefront of battling cancer. Bertha Coombs reports.
How are you doing?
So many cancers we don't have a good result in today. Not enough people are cured. People are hurt by our therapies, and we got to find a better way.
Mark Chris is Chief of Thoracic Oncology at Memorial Sloan Kettering Cancer Center.
There are some 3-drug regimens that contain a targeted agent.
Oncologists from Sloan Kettering have been working with IBM to turn Watson, the cognitive computer famous for winning at Jeopardy, into a tool to help doctors provide the best cancer treatment options for patients.
They would be getting 2 agents. They'd be getting potentially a chemotherapy and Herceptin or trastuzumab.
To train Watson, this last year the team ingested more than 2.5 million pages of cancer data, written text from medical journals, clinical trial research, and 1,500 case files.
Teaching the system how to read the medical records and medical reports, which is not a simple task.
Dr. Chris says Watson's ability to literally learn from each set of recommendations was one thing that surprised him.
And the second thing is just totally counterintuitive, that this machine is ultimately going to improve the care of each person. I mean, it's going to be the ultimate in personalized medicine.
Also counterintuitive, says IBM's Manoj Saxena, Watson's gotten smaller, using less server hardware while getting smarter.
We reduced it down first to about this size, at about 2 racks server side.
Analysts say with the rising cost of cancer medications, there's a big push towards more evidence-based medical care. Saxena says Watson gives providers overwhelmed by data the evidence they need.
So it's humanly impossible for the doctors to pull all of the medical records, the pathology reports, your family history, the most recent diseases and drugs that I've supposed to have done, and to bring it together at the point of treatment. That's where Watson as a decision support system, we believe, will have breakthrough implications.
Until now, Watson has been used with file cases. This summer, beta testing begins with patients in real time. If the trial goes well, the commercial product should launch for cancer care providers by 2014. In New York, I'm Bertha Coombs for Nightly Business Report.